You think Medicaid reform would work especially well for North Carolina if the federal money that comes in from Medicaid were turned into a block grant? Why?
Yes, that's correct. Well, with a block grant, the state could sort out program inefficiencies, would have more power over administrating its own Medicaid program. And with more power, they know what they can do to help the most vulnerable populations. They can use resources more effectively to help the most vulnerable populations. And they can also help the healthier, able-bodied citizens on Medicaid through work requirements, feeling empowered through their own health savings accounts to climb out of the safety net and climb the economic ladder and no longer need government assistance for health care.
Your report sets out some very complicated and confusing funding formulas with Medicaid now. Is that one of the big problems, the way it's funded?
Yes. Right now, the way Medicaid is funded and has always been funded is it's been jointly funded through the state and federal government. So that's formally known as the Federal Medical Assistance Percentage or federal match rate. Each state has their own federal match rate, and that's determined based on a formula of averages with per capita income compared to the United States average of per capita income. Currently, North Carolina has a 65% match rate, and because every single year the match rate is renewed, it's an incentive for states to, including North Carolina, lawmakers to spend without holding back because they don't have a defined block grant.
It sounds like it's just a very confusing system that would be hard for anyone to understand.
It is. There's definitely a tug of war at both the state and federal side. States obviously would like to have more control over their programs, but with federal strings attached with this, how the program is funded makes it difficult for states to administer efficient programs.